Welcome to the Conducting Global Research, Cross-Cultural Collaboration and Translating Research Measures webinar, presented by the American Psychological Association in collaboration with Psi Chi, the International Honor Society in Psychology. Thank you for joining us. APA is delighted to bring you this webinar, which discusses the benefits and challenges of conducting research across cultures. Let's begin with a few housekeeping notes. At this time, all lines are muted. If you require technical support, please submit questions within the Tech Support tab on the right side of your screen, not to be confused with the Q&A tab. You should be able to see the slides live. If you experience technical issues, please try to refresh your browser or window, or try a different browser. If you are behind a corporate security wall that has not approved this website for access, please contact your technical support team. To view the slides in full screen mode, click the screen icon next to Live on the lower right side of the slide. Press Escape to exit full screen. Closed captioning is available. You must click the CC bottom right within the player to view the captions. The PDF file of today's slides can be found below the Q&A box. Click on the link under the Handouts section to download the slides. We encourage you to submit questions about today's topic through the Q&A tab throughout the presentation. Questions will be answered throughout the webinar. Due to time constraints, we will not be able to answer all questions. If you would like to re-watch the session, a recording will be available within 5 business days of the original air date. You will be able to access it from your Beacon Live account dashboard. To obtain the 2 APA continuing education credits offered for this webinar, you must click OK when you see the attendance verification box appear on your screen during this webinar. All you need to do is click OK. Remember to respond to all attendance verifications you see. You must also complete a webinar evaluation, so stay online through the conclusion of the webinar, and you will see a pop-up appear on your screen with access to the evaluation. A CE certificate will be emailed to you and will also be available for download in your Beacon Live account dashboard. If you have any questions about continuing education credits, please email cpe@apa.org. It is now a pleasure to introduce today's presenters. Martha S. Zolokovich, PhD. Dr. Zolokovich, BA Psychology, UCLA, MS, PhD, Developmental Psychology, University of Florida. She joined Psi Chi in 2008 as Executive Director, leaving Southeast Missouri State University after 17 years, where she taught, earned a full professor, and served as Interim Director of the Center for Scholarship in Teaching and Learning, as well as Psychology Department Chair. She was instrumental in developing Psi Chi's Network for International Collaborative Exchange, NICE, crowdsourced data collection research project, currently Division 52 Treasurer. Kurt F. Geisinger, Ph.D. Dr. Geisinger is Director of the Burroughs Center on Testing and W.C. Minehenry Distinguished University Professor at the University of Nebraska. He has served as council representative for the Division of Measurement, Evaluation, and Statistics on the American Psychological Association and the APA Board of Directors member. Dr. Geisinger served as president of Division 5, Quantitative and Qualitative Methods of the American Psychological Association, APA, and he is past president of Division 52, International Psychology. He is also past president of the International Test Commission and the Assessment Division of the International Association of Applied Psychology, where he is currently treasurer. Dr. Geisinger's primary interests are admissions testing, testing individuals with disabilities, and the adaptation of tests across languages and cultures. Antonio Puente, Ph.D. Dr. E. Puente, Ph.D., was born in La Habana, Cuba, and emigrated to the U.S. in 1960. Dr. Puente is founding director of UNCW's Centro Hispano, and his research focuses on the interface between culture and neuropsychology. Dr. Puente is a professor of psychology at the University of North Carolina, Wilmington, maintains a private practice in clinical neuropsychology, and is the founder, 2002, and co-director of mental health services at the Cape Fear Clinic, a bilingual multidisciplinary health center serving the indigent. He is president of Division 52, International Psychology, as well as past president of the American Psychological Association. Antonio Skigales is in his final year as a master's student in neurosciences at the medical school, University of Crete, Greece. He has received several academic distinctions and has co-authored 17 publications. He is the first Psi Chi NICE chair outside the USA, coordinating the implementation of cross-cultural research project in over 25 countries. His main research interests focus on fMRI studies of cognition and emotion in healthy volunteers and persons with neurological disorders. Welcome.
Good afternoon. Delighted to be with you today and as part of this unusually strong panel and a very important discussion on issues that are emerging both in our country as well as elsewhere. My presentation is Understanding and Measuring Constructs Across Cultures, or if you will, making sure that the rat is more than just white. This is the presentation that I have for you in the next 30 or so minutes. I'm going to give you a little bit of background about myself. I'm going to outline the problem as I see it, try to provide a solution, maybe a possibility, and finally address some practical implications. So let me tackle, for starters, about the background. As mentioned by our introducer, I am from Havana, Cuba. This is where I spent most of my youth before coming to the United States and doing the best I could to acculturate. And in some ways, as my son, who is also a neuropsychologist, says, Papa, it's not research, it's me search. My background, even though I received my PhD from the University of Georgia, it really traces back to two individuals that really were formative in my thinking. Individuals that I had a chance to either work with them or in their laboratory. Specifically, I cut my teeth in the neurosciences with Roger Sperry, the first psychologist to win a Nobel Prize back in 1981 for his unusual and important work on how the two sides of the brain come together to form one unified consciousness. But it was his approach to this kind of question using a very strong scientific Western and quantitative skills that really set me on my direction to where I'm currently at. However, soon thereafter, and having been fascinated with Russian psychology and neuropsychology, I was invited and participated in several visits to and from folks from Alexander Lurya's laboratory in Moscow, Russia. Alexander Luria is considered to be the founder of clinical neuropsychology, but more importantly, his ideas of the brain include how to understand the brain, which, in contrast to Sperry, was entirely different. It was totally social, historical, and contextual. So it's in that vein that my very strong Western ideas became a filter through a different lens. So stay tuned because it's that combination that is going to be the foundation of my discussions with you today. And always, I wish I could take full credit for all the things we're going to be talking about today, but in reality, it's more than me, much more than me. It's all these people that make my everyday life very doable. And to all of them, thank you very much for working with me and giving me the opportunity to further these ideas at this particular juncture of my career. All right, so now that we've got the background underneath us, let's address the problem. What is actually the issue? Let's just talk about the US as an example. When I first came to the United States by way of Miami, as all good Cubans do, there were very few of us there. As a matter of fact, when my mom put me in Miami, North Miami Beach Elementary School, she said, you know, you're going to be surprised, but no one speaks Spanish here. And it was indeed a real problem for me. Not only did no one speak Spanish, but nobody understood my culture. And for that matter, I didn't understand theirs. Well, guess what? In 1996, things started, 1965, things started changing, and then it continued much to everybody's surprise, with a really shift on how is it that our population looks like. The demographics has changed so substantially, especially in the last few years, that what we see now is that the largest proportion of the increase in population of the United States happens to be not from the United States. And it looks like by 2050, the majority group culture, which is white Caucasians, will be a minority group culture, and groups like the Hispanics probably will be the majority group of the United States. Now, this turns out to be a major problem because it hasn't really reflected well in who we are as psychology. As an example, there are approximately 5,000 psychologists, neuropsychologists, excuse me. Of those, maybe 100 belong to the Hispanic Neuropsychological Society, and maybe about 50 are fluent in Spanish and are in a position to provide services. Well, it turns out that that's just really obviously not enough for this population shift that we're seeing. And just to give you one personal example of all this, it took 25 years for someone to speak Spanish to be certified by the Neuropsychological Certification Board, and I'm very proud to say that I'm the first person that did not pass the certification board. And similarly, with regards to the American Psychological Association, it took us 125 years to have a Latin American Spanish-speaking president. Not reflective of who we are as a demographics. So what does that do? Well, here we are. We have challenges to current psychological paradigms. First of all, we have a very significant lack of universal, inclusive, and sustainable paradigms. And the paradigms that we often refer to as DEI are very nationalistic and very race conscious. It's much more than that. As a consequence, what we find is a historical focus on structural rather than functional concepts. It's where you got your degree, whether it's APA approved or not. It has very little to do, or unfortunately, very little to do with the functional aspects. Do you understand people from other cultures? Are you capable of applying a global perspective of psychology? That is a different question. So we find ourselves in over-reliance on quantitative and easily measurable constructs. In talking to Sperry right before he died, I said, Roger, what do you think about the fact that we're missing the entire side of the brain that's hard to measure, like the right side? And he goes, that's probably the most important side, and that's the one that we know least about because it's not so easy to measure constructs like emotion. So we find ourselves in a situation that we have a very limited engagement of qualitative, social, historical, and cultural constructs. And if you look at my own evolution as a neuropsychologist, when I started all this, most of my neuropsychological evaluations were heavy quantitative. Now they're very heavy in terms of social, historical, and related constructs. So maybe what we have in our hands is a lack of concern for the true meaning of a construct. For example, what is intelligence? It's certainly not what was measured when I was given an IQ test and I didn't know English, because all my mom told me is simply smile. Who knows what my diagnosis was at that time? So what does it come down to? In 2014, the last version of the testing standards came out, standards for psychological and educational tests. And this comes from chapter 3 called Fairness, a section that I was very involved in. Let me just read it to you just for the record. A test that is fair does not unduly advantage or disadvantage certain examinees because of individual characteristics that are irrelevant to the construct being measured. When someone is measuring your intelligence using a language you have no idea about, they're measuring your linguistic abilities and not your intellectual abilities. So here we are a few years later. It turns out that, for better or worse, my son, better looking, better trained, and certified in neuropsychology. And I worked on an article where we looked at all the things that were out there that were available in the literature and did a complex analysis. And it turns out that there's relatively little, even though there's quite a few articles, there are very relatively little that meets the criteria for a good, solid meta-analysis. And what we discovered, not surprisingly, are things that we're going to talk about. But culture is indeed very important. As a matter of fact, I'll leave you with this idea as we go forward, that in my views, that linguistic variables, which we have historically considered to be the most critical, may be, in my personal opinion, secondary to culture, which are much more powerful and much more difficult to measure. So let's tackle, let's see what we can do to tackle the possibility of a solution. Is there some way that we can address this in a way that we can move forward? There's clearly clearly a significant disconnect between the demographics and the psychological personnel, and for that matter, science. It's just not there. So now that the problem has been outlined for you, let's try and tackle a potential solution to this particular problem. What are we to do to solve this difficulty? All right, here's an alternative paradigm, and it actually comes not from me, outside the fact that I happen to be president of Division 52, which is what brings Martha, Antonio's, and Kurt and I all together. And that is that we seek to develop a science that is contextually informed, culturally inclusive, serves the public interest, and promotes global perspective within and outside of the American Psychological Association. We need to have a psychology that is beyond Europe, beyond the United States, and for that matter, beyond those who are privileged enough to have access to the information that envelops the 4 to 5 million abstracts in PsycInfo. So how are we to do that? Here's a possibility to reconceptualize psychology, or as you can see in this slide, neuropsychology. First of all, let's go back to our roots. If we go back to our roots, we find ourselves in a very different situation that we actually have today. Whether it was Wilhelm Wundt in Leipzig, Germany, Ivan Pavlov in St. Petersburg, Russia, or our own William James in Cambridge, Massachusetts, all were actually neuropsychologists. And they had some interesting things to say about the role of the brain and the role of culture in all of this. Let's see. Number one, first of all, we've got to stop thinking as culture as something that we add to the equation. It's not something that we do in addition to. It's really much more than just an addition. How is it? We must shift from an add-on to a core. We should not be thinking about a DEI office in APA, or for that matter in Psychi, or for each in our own respective departments or institutions. Culture and DEI must be, has to be, part of everything that psychology does, and for that matter is. The way I like to propose is that neuropsychology or psychology is nothing more than the measurement and understanding of cultural constructs, not linguistics and not even cognitive. I'm proposing to you that the core of psychology is culture. Along those lines, we cannot achieve a true understanding of this using our traditional North American quantitative paradigms, which at the present time are lodged tightly between the very stronghold of behaviorism that's had in psychology over the last 50 or so years, and the introduction over the last several decades of cognitive science. Neither pay true attention to what's at the core of all of psychology. So I'm encouraging all of us to consider that we must have a qualitative, indigenous approach that is frequently found in the global perspectives of psychology and infrequently found within our own discipline in the United States and North America, as well as Europe. So, with that, here is a proposal for you to consider that reflects my own special interpretation of psychology. Number one, first, consider Sperry as the foundation for how we understand both psychology and specifically the brain. That on one hand, we have the left and the right hemisphere and his own neurophilosophy and upward and downward causation. Begin with a quantitative perspective of the brain and of psychology, followed by the addition of the Luria and his mentor's approach, Lev Vygotsky, who proposed the idea that we have more additional problems that are qualitatively understood. If we do that, we find ourselves in a situation we can bring both of those in a hybrid fashion. That is the solution to the situations. Here's an idea that came forth from the Minnesota Neuropsychology Conference held last October that suggests that the way that we do DEI is to demonstrate cultural humility, respect, and understand culture's impact on all professional activities, being aware of intersectional identities and associated inequities. The way that they propose is twofold. One, appreciate the concept of definition, which, by the way, I had take some ownership having been at this particular conference, is basically to develop culturally informed evaluations that use test procedures and measures that involve evidence based, reliable, valid, and culturally and normatively appropriate information. Without that, you are simply measuring error. Along those lines, if you're doing intervention, it must be critical, foundational, that it has to be evidence based and culturally responsive as well as patient centered. Now, how are we to do this? Well, hopefully, to address that, we have several things. We have to have new paradigms. We must include new personnel. We must have a different form of science. A science, as I suggested, that includes the indigenous, the qualitative, and it must involve new best practices. Otherwise, we will continue involving ourselves in error prone understanding of others. We must have new tests that are not just simply modifications like a translation, but an accommodation that never deals with a change in construct. We must understand the constructs and we must be true to them in our measurement. Our norms should be more important than ever before. Things like time and examining examiner matches must be focal as we move forward to a new standards and new age of what assessment of our construct should be like. Along those lines, here is something for you to consider as we move in towards the end of our presentations. First of all, are we measuring and transmitting scientific constructs, or are we measuring and transmitting cultural constructs? I think we have missed the boat in interpreting one as the other. Number two, is neuropsychology or neuropsychological knowledge nothing more than interpretations of power constructs? It took 25 years to certify a Spanish speaker as a neuropsychologist. It took 125 years for APA to elect a Spanish speaking president. And if you look at all the presidents of APA, you'll be surprised how many have been male, how many have been white, how many have been from the Northeast. Along those lines, are these power constructs developed by a cross sample of the population we seek to understand and serve? Have been involved in the standardization of the Weschler intelligence scales over many years? we are not truly capturing all the people that reflect the demographics of our nation, and certainly not of the world. For example, the waste three in Mexico basically come from one city, which happens to be very large and not reflective of all the populations of Mexico. Along those lines, maybe another question could be, are we really doing a disservice to all of us? Because when it's all said and done, are we just trying to establish the preservation of the intellectual and social status quo? And just to continue, is neuropsychological or psychological knowledge nothing more than intellectual and societal imperialism? The constructs that we measure are not reflective of the constructs that reflect intelligence, for example, in the rest of the world. When most of the waste is focused on time and the rest of the world appreciates, values, and enjoys time, and we in this country only conquer it, we're mixing culture with intelligence. So we must fix the intellectual imperialism that we currently have that engulfs the past and in many ways the present. Along those lines, we need to reignite the dream and promise that Pavlov, that Wundt, that James had back in the 1890s to suggest that maybe an intellectual ignorance of the present cannot get us to appreciate our past or obtain a sustainable future. And along those lines, are we going to continue making the rat still white? As Robert Guthrie said in his most important history of psychology book, or are we simply just doing modern phrenology? As Brown did 150 years ago, a very quantitative assessment of the brain. In using the book that I have in my own office, here one, this is not what psychology should be. So I leave you with a question. How do we measure the constructs? And in fact, maybe in a bigger question, what are those constructs? The future of psychology cannot, should not be remaining in the hands of those that held the power of our discipline in the past. Appreciate the opportunity. Here's some wonderful resources that APA made available through the leadership of Jennifer Kelly a couple of years ago. If you want more information, you're welcome to take a look at my Vita, which has a lot of these articles and presentations in PDF format. So with that, let's tackle a couple of questions before I turn over the presentation handle over to my good colleague, Kurt Geisinger. Dr. Martha, I cannot believe that you've asked this question. How do you think adopting new paradigms, new tests, and new norms affect psychology education at the undergraduate level and the graduate level? Well, I'll give you an example. I did a site visit several months ago at a university that was inside a city that was ethnically extremely diverse. And inside the university were a bunch of white males teaching. It was like, what, how do you make this happen? How do you mismatch the university faculty to the demographics in where you reside? And first of all, we must change not the demographics of the students, because that's who we're here to teach, but also we must change the demographics of the faculty. And to do that, we're going to have a different pipeline system than we currently have at this particular point. Dr. Slakovich, this is a hard question, and this is a paradigm that's going to take a long, long time. I will tell you, I've done my very best personally to make that change, and I'll share with you what I've done. I ended up having 3 kids, of which 2 happen to be psychologists. So tiny, tiny way of making a change. Hopefully, as time goes on, we'll make systemic big changes. Otherwise, all of this is not going to be of any value. I remember many years ago visiting Kenya and going to the University of Nairobi and asking them, where's your psych department? And they said, psychology is not generalizable to our lives in Africa. Wow. That means we have no future for the rest of the world. And I look for people like Antonius, who's going to be chatting with us later on, and my own children to make sure that our future develops a construct of things that are basic to who we are, like intelligence, like memory, like problem solving, even like personality, that and captures constructs that apply to all of us, not just the few of us that are privileged, like the ones in this presentation. So I'd love to hear any additional questions. And if not, I'll form one myself and then I'll pass it on. I had the opportunity yesterday to talk to a master's program in neuropsychology at the University of Bethlehem in Bethlehem, Palestine. One of my students is now a professor there, and I had a question that was really difficult to be asked. And here's the question that I was asked: why does the U.S. think they're the center of the universe and everything, including psychology? Oh my goodness. I felt like I had to take the dagger out of my heart and make sure that the blood flowed to my brain to try and address that. And I just punted by saying, we've been doing it so long, but we are now with the folks like Amanda Klin leading our Office of International Programs, among others, and the importance of Division 52 International Psychology and Psi Chi's international efforts. Maybe the tide is turning. What we have to have, as a presentation I heard this morning, a bidirectional communication. We must inform the world, and the world must inform us. Together, we have to come forward with a global psychology that encapsulates all of us, not just some of us. So, with that, unless I see any other questions, I don't see any others. How about I turn over the microphone to my esteemed colleague, Dr. Kurt Geisinger. Thank you very much.
Thank you, Dr. Puente, very much for that presentation. And I think I can say the topic of my presentation is actually on test adaptation in a shrinking and diverse world. And I think while the topic is different, I think you will see a lot of similarities in some of our comments that we make in our two different talks. Okay, so as a quick introduction, I have 3 slides here. I'm going to talk about um, changing tests in a way that make them adaptable to different languages, different countries, and so forth. And we call that test adaptation. At one time, it was called test translation, and I'll explain why we believe we need a difference. And I'm going to give you some historical perspectives on the whole change. Then uh, we know that the world is shrinking, that globalization we can't get away from. It's clearly a world where you can access websites all over the world. You can communicate with people easily all over the world. That's very different from even 50 years ago when I was in graduate school, for example. And I think you'll see that in addition, as psychology has grown as a discipline, and I agree with Dr. Puente that it's most of us here in the United States look at it as American psychology, although we don't know that that's what it is. There are constructs like the big five personality factors that seem to have worked at least in many Western cultures. And so we have to find out where constructs, personality characteristics, and so forth work across cultures and where they don't, and then to come to some understanding of that. But psychological science has developed methods that make it stronger. Our theories have now taken on, sometimes at least, culture. And I'm going to say, I've said this in a number of talks I've given in my life. I spent, like Dr. Puente, I spent my first 2 years in graduate school in psychology at the University of Georgia, and then I switched to Penn State for 3 years. I can only remember one time when the word culture was used in a class, and that was in a course I took my first year on testing, and there was one article we read that there were cultural differences among minority populations within the United States. That's it. Culture has become a term that we talk about in psychology, but just 50 years ago it was divorced because we thought that's the domain of anthropologists and others. And we have to decide there's a difference between etic measures, which are cut across cultures, and emic measures, which are much more culturally based. And those are terms that come from psychology and anthropology. And there are a lot of both psychological and pragmatic reasons why we might adapt tests from one country to another. In other words, people come to the United States, they go to graduate school, they learn certain measures, and then they go back to their home countries. They want to try to adapt a measure that they've learned in the United States to that other culture to see if it works or not. And when we talk about adapting a test, we have to understand we're taking it from an original population and moving it to a target population. And that target population is the country and culture in which you're trying to make the test meaningful. And the two main differences are language and culture, but there are actually even some others like geography, and then there's some psychometric characteristics that you might want to study. We're not going to talk about the psychometric in this presentation, but just changing the language, and most of us have tried to build something, let's say, that came with directions that have obviously been built by Google Translate or been translated by Google Translate, and the language doesn't make a lot of sense. Well, that happens, but there are also different cultural issues, and these are much more harder to identify than the language differences. We all understand that the Eskimos have 7 different words for snow, and we only have 1 in English, but the reality is their cultures are different to the point that we have to understand the cultures as well. Now, I did the paper that I'm best known for in my career is something called Cross-Cultural Normative Assessment, Translation and Adaptation Issues Influencing the Normative Interpretation of Assessment Instruments. That was published in Psychological Assessment in 1994 and is cited as often one of the first papers that looked at translating or adapting tests from a broader perspective. Now, one of the organizations that I've worked in for many years, called the International Test Commission, has actually come up with a set of guidelines for the translating and adapting test, and they came out in the first edition in 2005, and later in 2017 a second edition. And I've provided the website there where you can access those guidelines. They're not standards, they're guidelines, which is less formulaic. They organize themselves in the following way. They describe the context of why we're doing this, some test adaptation and development procedures, how you have to administer the test different. And I just saw an example of a test that was written in English and translated into French, and people don't remember. Dr. Puente was talking about time differences. Well, that is a big issue in a lot of tests, but even in terms of language, the instructions for taking the test were 3 times longer in French than they were in English. And so it's when you start changing things across languages and cultures, it's not always an easy translation. Then you have to know about score score interpretation, and that comes from documentation of both norm studies and validity studies. And finally, I'm going to skip the diff, but there are ways to look to see if items are measuring similar things or measuring them differently across languages and cultures. Now, there was a first book that really came out in 2005, edited by some famous people, including Charlie Spielberger, Peter Miranda, and Ron Hambleton, all of whom have now passed on, called Adapting Educational and Psychological Tests for Cross-Cultural Assessment. I have a chapter in that book based on one of my students' dissertations. And actually, I'll just mention briefly that the student, Carlos Maldonado, was a psychologist in New York who had grown up in Puerto Rico, and he was bilingual, and he tested people both in English and in Spanish. And one of the things he was finding was that the Puerto Rican adaptation of the WAIS, the IWA, gave people scores that were 15 to 20 points higher. Now, on one hand, you could assume that that's because, well, their home language is Spanish, they could do better in Spanish. But the reality was we checked it and we tested people equated for their language competence on some tests from the EWA and some tests from the WAIS. And what we found is it really was a norming problem that was done when the test was normed in Puerto Rico, not just the language issue. The International Test Commission has come out with this International Handbook of Testing and Assessment that I have a chapter in, but it's a great resource for people interested in testing. And the test adaptation chapter was written by one of the really great European psychologists who died a couple of years ago, Frans van der Wever. There's also a new book, also published by International Test Commission through the Cambridge University Press by one of my co-authors, Dragos Iliescu from Romania, Adapting Tests in Linguistic and Cultural Simulations. That's probably the most up-to-date book that there is right now on test adaptation. So those are sources that people could go to if they want some additional information. Now, I'm going to talk about two precursors before one even decides I'm going to adapt a test from America or from England to some other culture. There's two things that you really need to do. And the first is, if it's a published measure, you have to get permission from the copyright holder. And I've given you a citation of an article that doesn't deal with cross-cultural, but it has to do with a scale that was developed for determining whether people took their medicines when they had certain diseases. And the scale was used almost exclusively by pharmaceutical firms because they wanted to find out if patients actually got better and whether they followed the regimen that their doctors prescribed for them when they had certain diseases. And it's a very short Likert type rating scale, I think there's 5 to 10 questions on it, depending on, there's some for specific diseases. Well, it turned out this scale was being used so much by pharmaceutical companies that graduate students decided they wanted to use it for their dissertations. And they wrote the professor who held the copyright in many cases, and he was retired, and so he didn't necessarily respond to them quickly. And a number of students decided, well, I'm going to use this scale without permission. And he later found out about it. He filed suit against the students. He wanted them to pay what the pharmaceutical companies would pay to use it, which was in the tens of thousands of dollars. And ultimately, it was all settled. But the reality is the article in Science walks through this issue that one, people who have copyrights do have certain rights. And on the other hand, students shouldn't be expected to pay what a pharmaceutical company would. Now, and I would say my second point here is even if it's a non-published measure that is not copyrighted and it maybe was used in a master's thesis or a dissertation, professional courtesy suggests that you would inform the original author and either ask permission or at least tell them that you are planning to adapt their measure. Now, why do it? There's a whole lot of reasons why you might adapt a measure. One is that it's something you've learned in your own study. It's a name that is recognizable, like Weiss or Weschler, as Dr. Puente mentioned, it at least seems initially that it's going to be more cost effective and time effective to just translate it and so forth. Third, globalization. Actually, as we try to make cross-cultural comparisons, it helps if measures are the same measures. It's very hard to compare one measure in one country with another measure in another country. And lastly, we now have guidelines that help us adapt tests and so forth. The cons for doing this is, of course, copyright and country membership requirements can be difficult. Second, there's a question of whether the benefits of having a name that you can continue to use and so forth justify the efforts. And as you'll see in some cases, the efforts can be pretty dramatic at times. We have the fairness and validity issues. Just translating it or adapting it doesn't mean it's just as valid in a new culture. And Dr. Puente gave some examples, but I attended, for example, the first Pan-Caribbean Conference of Psychologists and the first Pan-African Conference of Psychologists across that continent and across the Caribbean. And in both cases, one of the things they talked about was colonialism, that they are really seeing as a huge factor in the development of Africans all over the continent and in the Caribbean, of the fact that they were colonial countries for many years and they've had to break free from that, and that's a huge factor in their psychological development. And translated measures, even with adaptation, will sometimes introduce something different than what was really initially intended. So why adapt it? Well, the Organization for Economic Cooperation and Development does comparisons across a number of educational variables, including mathematics and critical thinking. We're going to talk about the critical thinking measure in the past. Second, in America, the perception is everyone should speak English. I can tell you I've given some talks in Mexico, and Mexico took a very different perspective with regard to their indigenous peoples. There are something like 30 indigenous populations in Mexico, and what Mexico has decided as part of their educational experience and their educational testing, that they're going to test all indigenous peoples in their home language, in their original language, and secondly, they're going to test them in that language rather than in Spanish. They learn Spanish as a second language. So I think this is something that is very important, that Mexico has taken a very different model than the United States. In South Africa, there are actually 11 official languages, and all their testing and so forth, including personality tests, are done in all those languages. And as Dr. Puente also mentioned, we live in a world with incredible immigration. We may only think about it from the United States, but 20 years ago, I gave a talk in Austria, and the Austrians were very concerned about all the Arabs coming in from different Arab countries. Now, why would you not adapt a measure? Well, it could be that the construct differs across cultures. And an example of that is here in the West, we talk about the big 5 personality factors, but Fanny Chung, who's one of the great personality theorists cross-culturally in the world, and who was the first author of the MMPI in Chinese. She actually came and got her degree at the University of Minnesota studying the MMPI, and then developed a Chinese version of it. She's now also developed the Chinese personality inventory, which has a 6th factor, which is sort of a collective factor that is big in most of the South Asian countries that's not found in the United States. And sometimes the original mode of measurement even is almost non-existent in other target countries. And my simple example of that is when the United States first started pushing tests into England, we were using multiple choice tests, and they tend to use essay tests, and they had never even seen multiple choice questions at that time. And so you have to decide that this is a construct that is, in fact, cross-cultural, that it has importance cross-culturally before you even think to do that. Now, Van de Viver talked about three things that we have to see that they're equivalent. First is language. We want the test to be equivalent in terms of language, uh, and I'm using usually target and original population. So there's two. There could be multiple. Then you want cultural equivalence, and lastly, you want psychometric equivalence. You want the test to be somewhat equally valid in both countries, in both settings, in both cultures. Now, you also have to decide if you're going to adapt a test. First, you have to adopt it, and you should be doing that based on the literature in the United States that make you think that this is going to work in another country. And then you get into test adaptation, and we use the term adaptation because it takes cultural into effect and other factors, including geography, as I'll give you as an example in a little bit, that we're not just translating words, but we have to rewrite the whole test sometimes because it just doesn't make good sense in the original, if you translate the original language. There are skills that are needed to do this. You have to have fluency in both languages, a comprehensive understanding of the constructs involved, a thorough understanding of both cultures, and you have to know something about testing and test construction. These skills are rarely found in one person. A lot of tests that are translated by one person, but you'll find the failings then, and I would argue that very often a committee does a better job than one person. Now, the types of translation, you can do simple translation, that's the Google language approach. Then you can do translations with checks. And the first system that many older psychologists still stand by is called back translation. That's most common. And my next slide will tell you why that's not a good system. But here you actually translate it to the language the target language, and then you translate it back. You have a second translator translate it back to the original language, and you see how comparable they are. Then you can have the committee approach that I mentioned, and then there's something that's now being used by OECD in their comparisons of education across different cultures, where they develop all the tests at the same time in multiple languages, and rather than having one original language original test in English and then adapting it, they actually build them all at the same time. Now, why back translation is problematic is pretty easily understood if you're bilingual. First off, if the back translator finds out that they're being evaluated based on the quality of the back translation, what they do is they use wording that is most likely to lead to the best back translation rather than the most appropriate language in the new target culture. So that's really an important distinction, and it is problematic. And we found cases of tests that because back translation was used in the second language, it simply wasn't optimal language at all. Now, let me give you a simple example of an MMPI item that I've shortened it a little bit here. The actual MMPI item is most of the time I feel blue. That's a true-false question on the MMPI that looks at depression. Well, what does it mean to feel blue? Can you imagine translating that into a different language? I feel blue. What would I feel red mean? Or I feel purple, or I feel yellow? I mean, it's a term that means something because it's colloquial, but colloquial expressions have no real place in a situation like this where you're adapting a test to a different language. So you have to find a different way to ask the same question. Now, I'm also going to give you an example of an item with a translation error. This comes from a test. PISA is a universal science comparison where they write science questions for people in different grades. This is a fourth grade science question. It was a multiple choice question. Why do ducks swim so well? In English, the correct answer is that because they have webbed feet. In Swedish, the answer is they have swimming feet. The Swedes did the best in the whole world on that question. The fourth graders in Sweden got that right more than anyone else. But why do ducks swim so well? Because they have swimming feet is probably a bit easier than they have webbed feet. So we start seeing how wording gets interesting. Now here was an analogy question. Out of sight, out of mind were two of the initial parts of the um, of the analogy. Well, when that came back in back translation, it was blind and insane. Clearly, out of sight, out of mind means one thing, and blind, insane means something very, very different. So this is from my 1994 article. I'm just going to run through these really fast. How do you adapt a measure? Well, first off, you translate and adapt it, make changes due to culture. Then you have people review the translated measure to see that it makes sense. Then you revise the measure based on comments and suggestions that have come forward on the review. Then you pilot on a few people to see what they think. Then you field test it on a larger group of people. You standardize the scores. Then you perform validation research as appropriate. You can't just assume it's going to be as valid in the new culture and language as it was in the original. Then you develop a manual and other documents for users of assessment, train people on it, and collect reactions. Now, lots of people, since I've listed those steps, have come up with others. In the APA Handbook of Testing and Assessment, Erickson and Lyons-Thomas came out with another set of steps. Hamilton and Patsula suggested that I had missed some steps, and they listed out hiring appropriate translators. You may need to hire other people, of course, as well, to ensure that the construct equivalence is a first step. Decide whether to adapt or build anew, and to link scores across comparisons as appropriate. Now, I would also argue, imagine a projective test like a Rorschach that could be given in various cultures. The rubrics for scoring that may be very different as well. I mean, you could have the same stimuli in different languages, but how that's scored may differ very much in different cultures based on cultural issues. Now, there's a project that OECD did called AHILO, which stands for the Assessment of Higher Education Learning Outcomes. And what they did is they started with an English measure, an American test called the Collegiate Learning Assessment that's published by the CLA. It's called the CLA. It's published by Cooperative Assessment in Education. And it's an outcomes measure for colleges to see the extent to which students have learned to think critically. And it's about a 2 or 3 page document that you read. Sometimes there's figures, and you're supposed to write an essay to solve a problem, and it's looking at your critical thinking as you analyze it. There's no right answer, and a particular item was picked to be used internationally to judge whether different countries were educating people equivalently on critical thinking. And in this problem, it was explained that there were 2 lakes connected by a river, and the local power company wanted to install a dam for hydroelectric power. However, there's a endangered fish that lives in the whole world only in this river, and by putting the dam in, you are to some extent risking the endangered species of fish. Now, there's no right way to solve that. You can imagine building the dam, you can imagine not building the dam, and so forth. There's lots of different things you could do, but what they were doing was trying to come up with these essay tests that would get at whether people could think critically. Now, Burroughs, I'm sorry, I'm going to go back for a second. Burroughs had the project to adapt this for South Korea, Slovakia, Egypt, and Colombia. I'm going to walk through some of the issues just to give you an example. Now, I've explained the problem here, so I'm going to skip this. And so they've been hired as a consultant to the power company. Okay. We worked with these teams in different countries. I'm going to go through this very quickly because I'm running out of time. Uh, with Slovakia, there were no problems at all. They're a Western country. They have rivers, they have lakes, they understood. Then we got to Kuwait. Well, now Kuwait had been done the year before us, so we didn't have to do it. We were doing Egypt. But what Kuwait did is they have no rivers in the country, they have no lakes in the country, they have no water power in the country. So they changed the question that they were getting power from the waves of the ocean and um, the moon moving the tides, and that there was a seagoing fish that was being endangered. That makes it a bit of a different problem. Then in Colombia, I had done some work previously on graduate admissions measures in Spain in Spanish, and what we found is you need several languages, and indeed in Colombia we had to change the language quite a bit from one that had been done in Mexico previously because the languages were different enough. Finally, in South Korea, they thought they had developed a great translation, but the psychometric data looked really awful, that students didn't seem to understand the problem. And I was lucky enough that I had a graduate student from South Korea who read it, and she says, well, this doesn't make any sense because all the power in South Korea is controlled by the government. There's no for-profit companies. There's no attempt for this. And so we had to change the question subsequently to making you a consultant to the government who's trying to keep the costs down for people using the power. Again, you see you're changing the test. And finally, we get to Egypt, where I actually was there in the middle of the revolution. I'm going to skip that for a moment. First, Arabic is somewhat different in Egypt than it is in Kuwait, so there were some language issues, but they certainly knew rivers and lakes. I mean, we were within sight of the Nile, and we actually found out that the real problem there, that they had to grapple with our help, was that no citizens in Egypt thought that the government or that a private company would ever come forward and ask a citizen for help, that the government believes it has all the answers. And so they actually changed the question to be one that said, you've been hired by an American company. This is an American situation, and you've been hired by an American company to solve this. So a few lessons. I'm closing up here. A few issues here that you have to take culture into account. And this is one of those things. I'm so glad that Dr. Puente went first because he talked about the importance of culture. And I've tried to raise a couple of geographic things that influence culture too. And we know weather and other things do influence culture. You have to train people, and they have to be both bilingual, and they also have to understand the cultures in different, so that you don't have I feel blue being translated quickly from one language to another. They have to know something about the economic climate in different countries and other factors. Let's see here. And another lesson is context matters. Different countries have very different proportions of the citizenship that go to colleges and universities. So one country that may only let 5% of people go to college is going to obviously do much better than one that has 65%, similar to the United States. And some of the same issues that can be considered with regard to international assessments can also be seen within the world, within the United States, for some of our subpopulations where there are language differences, cultural differences, and so forth. So perhaps the theme of my talk is that adapted measures do have huge appeal and potential, but we need to be culturally sensitive and language sensitive, and we need to conduct more and better research on these adapted measures that are culturally based, and we need to be thoroughly reviewed. And I believe that's the end of my talk. And so I have a question here that comes from Dr. Puente. Do I see psychology moving past a colonial and decolonial battle, especially in terms of testing? Well, first off, I don't think there's one psychology. I think there are going to have to be differences in psychology. And I heard that from both the people in the Caribbean and in Africa, that especially in the Caribbean, they basically came out and just said, we reject American psychology. It does not work for us here. Uh, Obviously, there's some things like reward structures and reinforcement and so forth that do, but they basically said, we reject a lot of American psychology. We need our own psychology. And that's largely what I've heard in Africa. Now, over time, can they move to a decolonial approach? I would think so. But I think in the short term, we're going to have to take into account in Africa that there is this strong set of differences. I mean, I've traveled primarily in South Africa, and while that country has changed dramatically, it still has a long way to go to reach the standards of the United States, and that's not to assume that the United States is unbiased. So I think this is where Dr. Puente talked about Amanda Clinton and some of the work she's doing. I think we have to come to understand in the United States that one, we don't own psychology, and two, we have to be willing to learn about other countries and how they perceive psychology and the needs of psychology. And I think testing should wag the dog of, psychology should wag the dog of testing rather than vice versa. I mean, we have to build our tests consistent with the psychologies that are relevant. So with that, I think I am done, unless there's another question. Thank you all very much for your attention. Oh, I just saw a second question popped up. Some of my examples point out how easy it is to make a mistake in adapting a measure. What encouraging words do you have for researchers wanting to conduct cross-cultural research? I think one has to identify first and spend really some time thinking about, is this a construct that actually exists and is pervasive in both cultures and affects behavior comparably in both measures? And then, if possible, if you're starting, I would build the measure in both languages for both cultures at the same time. I think there's a lot to be said for that. Now, if there's already a measure in English or in another language, then it can be adapted, but it needs to be adapted in a way that makes it comparable in both languages and cultures. And that's what's really hard, because the cultures are different and you just don't know if it's going to be the same or not. Thank you again.
Thank you very much, Dr. Giesinger. I didn't plan that, but I will also start with one of your examples. So let's explore one very common English phrase, feeling blue. While we all understand its meaning, translating English metaphors such as this into other languages poses challenges. The fact that one phrase makes sense in one language doesn't mean that it will make sense in all the others. For example, in Greece, to express sadness, we will say "έχω τις μαύρες μου," which literally means I feel black rather than blue. If you translate word by word the English phrase "I feel blue" in Greek, it will make no sense. Another interesting example is the word craving. Despite being widely used in psychological literature, you will be surprised that according to Dr. Holmes and Rosen, it doesn't translate well into more than half of a sample of 20 popular languages.
Thank you for that introduction to the topic of translating research methods into other languages, Antonis. Or as Dr. Geisinger mentioned, test adaptation. by collaborating with people from the relevant countries. Today, Tony and I will be talking about challenges in translation and adaptation of cross-cultural measures using the specific example of Psi Chi's NICE, or Network for International Collaborative Exchange, crowdsourced data collection project.
Our presentation consists of 3 parts. First, we will talk about the NICE project and its aims. Second, we will talk about the process the NICE committee employed during the translation of this year's project. And last, we will emphasize the importance of cross-cultural awareness and sensitivity during the translation process by presenting specific examples of challenges and how they were addressed when translating our measures into different languages.
So what is the NICE Crowd Project? The NICE Project is a crowdsourced global research initiative of Psi Chi. Since 2018, Psi Chi has selected 1 research project, except for one very busy year when we picked 2, and developed a cross-cultural network of researchers to support carrying out the project. We offered the opportunity to collect data to any university-level student or faculty member anywhere around the globe. The students and faculty are not required to be Psi Chi members or to have a Psi Chi chapter at their university. The NICE committee supports this global group of researchers as they prepare to collect data using the same research protocol. The main purpose of our program is to facilitate cross-cultural research projects at as many sites and in as many countries as possible, and to use open science practices to do so. Because all data collection sites use the same measures and methods, at the end of the project, data collected across the globe can be pooled to create one large cross-cultural data set. As you can see on these maps, NICE Crowd started in 2018 with researchers from 7 countries, and since then has grown to more than 30 countries participating in this year's project, with researchers in another 4 countries still working on their IRB approvals.
Historically, the Network for International Collaborative Exchange emerged from the original idea of our executive director, Dr. Matas Lokovic. This idea was further developed by our research director, Dr. John Entlut, who is my mentor, former diversity director, Dr. Susanna Geller, Psi Chi editor emeritus, Dr. Debbie Brannan, and the former Psi Chi board president, Dr. John Gray. They selected the first NICE chair, graduate student Kelly Kokulo, who successfully established the NICE protocols as they exist today. In the NICE team, we call Kelly the mother NICE and Martha and the rest of the group the grandparents of NICE. Every NICE chair since Kelly has been a graduate student. So, what are the annual steps of the NICE crowd? First, the NICE chair issues a call for cross-cultural research proposals. The proposals are evaluated by the NICE committee, and 1 or 2 are selected to receive support from Psi Chi. Then is the actual implementation phase of the selected research protocol and the recruitment of contributors. My work as the NICE chair is to help the principal investigators build a network of contributors around the world. We give a lot of emphasis on being inclusive, and we always love to have researchers from diverse socioeconomic and cultural backgrounds, and from both small and large universities. Furthermore, we try to democratize the research process as much as possible, and that's why being a contributor and having access to all the research documents is free of charge, and Psi Chi membership is not a requirement. All the documents of the study are uploaded to the Open Science Framework, which is a free and open source project management tool that helps researchers save, store, and manage their materials. Broadly speaking, the role of a contributor is to submit the research proposal to the Institutional Review Board, IRB, of their university or equivalent institutional authority and translate the measures into the language of interest. After approval, we provide them with a Qualtrics web link to start data collection at their site. Both for the data collection procedure and the translation process, it is important that we follow the ethical requirements for conducted research in every country. Clear examples of IRB forms are provided to all contributors, and when necessary, the NICE chair provides individual support during the IRB application process. We are fortunate to have received IRB approval from 30 countries in this year's project. The study focuses on examining the effect of culture on implicit self-theories and specifically exploring the role of culture in the development of a growth mindset in the workplace. Participants must hold full-time jobs, reside in the country of the contributor collecting data, and be able to write and read in the language of interest. Now that we have finished the first part of the presentation, in which we talk about the aims and brief history of the NICE crowd, we will move on to the second part, which is about the translation process during this year's NICE crowd project. In this year's project, we made significant efforts to ensure that the surveys were translated and adapted to the most appropriate language for each country. To select the most appropriate language, the NICE committee engaged in discussions with a team of contributors from universities around the world. The project, Measures, Flyer, and Blurb was subsequently translated into 20 languages. Our aim was to be as inclusive as possible and ensure that the language used represents the culture and the values of its researchers' target population. For example, even though 4 countries use Spanish, we made sure to adjust the instruction and demographic questions so they align with the cultural context of each nation. The same approach was taken for English. For example, beside the States, countries like Nigeria, Nepal, Canada, and Pakistan utilize the English version. We didn't expect that all these countries have the exact same descriptions for variables like education or ethnicity. Securing permission to use and translate a scale is always the first step in the research process and ideally should be considered in the design of a research project. For NICE, we generally prioritize projects that have been adapted to at least one language other than English. In this way, we try to make sure that the scale presents sufficient psychometric qualities in cross-cultural studies and can be utilized in countries beyond the United States. The next step in the process is to locate available translations in the language of interest or request the adapted scales from the original scale authors. Scales that have already been adapted can be very useful. That have already been backward translated in general. With forward translation, we mean the scale is translated into the target language. And with backward translation, the scale is retranslated from the target language back to its original one. However, it is important to note that already translated scales may not be culturally sensitive or translated appropriately. For instance, I have encountered many scales adapted into Greek, but without being gender inclusive, as they use only masculine type of adjectives and not the feminine ones. For scales without available translation, a forward-backward translation procedure was followed. The translators were usually groups of professors and students in universities of the same country. They were fluent in English and their mother tongue was the language of interest. They collaboratively translated the scales. Then, contributors were requested to give the translation to an independent person, preferably a bilingual with English as their mother tongue. This person performed the backward translation process by translating back the questionnaire into English to ensure conceptual and cultural appropriateness. After this procedure, all the translators met up again to discuss discrepancies and select the most appropriate terms. If unresolved issues arose during this process, some contributors from Serbia, Poland, and Greece sought feedback from other experts in the field or from the original authors. When necessary, the suggested changes in the meaning or structure were also discussed with the NICE committee and the principal investigators of the project. Throughout this process, we tried to have as much control as possible so the contributors did not add any inappropriate clarifications or modifications that may threaten the validity of the scales. It is essential to keep in mind that beyond the items, instructions and response choices must also be adapted to the culture of interest. This is an important point that we will discuss afterwards, as well as the translation of anchors and response choices may be challenging. Finally, contributors were instructed to make sure that the language used is appropriate for the country of interest and the target population, and pay special attention to sensitive terms such as gender or ethnicity. Translators should have deep knowledge of the target language and the target culture and be aware of what is appropriate and ethical to be asked. And that's why having professors and students from multiple countries promotes inclusivity and ensures familiarity with psychological research and testing principles, as well as contextual appropriateness. A great lesson from NICE is to avoid making assumptions or working alone, and always consult with translators who are native speakers of the target language and know well the culture to which the language is adapted. Even if Nepali is the official language of Nepal, for the purpose of sampling full-time workers, English needed to be used as it is the primary language for business there. In the United Arab Emirates, it was more appropriate to use both English and Arabic, so people could choose in which language they preferred to answer. Of course, the current translation process has a lot of room for improvement, and as the program evolves, we are trying to find ways to improve this process. In the future, it will be beneficial to create at least 2 independent translations during the forward and backward translation process as supported by relevant guidelines. It will be also useful to follow a reconciliation process after that, where the discrepancies of, sorry, the slides, somebody changed, oh, here it is. Sorry, the slides changed, oh, here we are. Okay, it will be also useful to follow a reconciliation process after that, where the discrepancies of these different versions of the forward and backward translation are discussed by the teams, the original authors, and experts in the field and combined into one. In addition, cognitive interviewing with the target population will be very useful. For example, how do full-time workers in a particular nation understand and comprehend the translated terms? Pilot studies and cognitive interviewing are very useful, but unfortunately they're also very infrequent, and they're usually addressed by post hoc multi-group confirmatory factor analysis, which the PIs are going to use in this year's project. For example, you may notice that the factorial structure of a questionnaire is not similar in every country, and the translated items do not fit well into the factors extracted by the original English version. This may indicate that questions generated in a single culture may not be meaningful or conceptually equivalent in others. Overall, using both CFA and pilot studies will be the ideal solution, as they may indicate that scale is not suitable to be used in a particular culture even before the main data collection procedure. Now that we have finished with the second part, which was about the translation process in this year's project, we will move on to the final part, which focuses on challenges and sensitive topics encountered during the scale translation process. So, languages differ in the extent to which they mark gender in nouns and pronouns. And one of the greatest challenges in this year's project was to use gender-inclusive language. Grammatical gender languages like Greek or Spanish require adjustments to include both feminine and masculine types. For example, iremos in Greek is a masculine type of calm. But to be more inclusive, you will also need to include the feminine type, iremi. And the same is true for Portuguese. Calmo is a masculine type, calma is a feminine one. In Albanian, student, the masculine, studente, the feminine. Similar adjustments had to be made in Spanish and Polish. Of course, as you notice, we solely talk about a binary system here, considering only feminine and masculine types. There is currently no consensus in many of these languages on how to express non-binary identities. However, some improvements are made in this direction. The official dictionary of the Swedish language recently added the gender-neutral pronoun hen, which is widely used in Swedish schools or even in the parliament. Finally, using gender-inclusive language is not only a grammatical issue, and researchers should be aware of not inclusive terms such as mankind instead of humankind. Another challenge concerns the way you ask about gender identity in different cultures. Again, inquiring about gender identity requires deep knowledge of the target culture, as some terms may not be suitable in different contexts. For example, in Croatia, terms like non-binary are not widely used, and even the option other is not appropriate to be used in the United Arab Emirates. In addition, people may prefer different terms in its context. For example, two-spirit is a term specific to indigenous and Native American communities. Open-ended questions such as how do you currently describe your gender align with APA's guidelines, but if you choose multiple choice questions, be sure that your categories correspond to gender in a culturally sensitive way. The NICE crowd aims to be inclusive and involve as many countries as possible. Thus, we do not prioritize projects that touch on topics sensitive in certain regions. For example, in some contexts, people may be prosecuted for non-conventional consequences about sexual orientation, religion, or political views. And researchers should always be aware that by asking these questions may violate ethical standards in a particular country. Ethnicity and race are also sensitive topics that require cultural awareness and consideration of legal restrictions when asking about them. For example, terms like Black or African American have been associated with discrimination and racism, and their translation is highly inappropriate to be asked in countries like Greece. In a previous NICE project, we had to review the national standards for asking such types of questions in the Greek context. To devise an appropriate question about ethnicity, we also have to acknowledge the different ethnic groups in its country of interest. For example, Maori in New Zealand. Open-ended questions about race and ethnicity were used in this year's project and are appropriate as they allow for self-identification. But if you choose multiple choice questions, please make sure to be as inclusive as possible and make sure you also have a prefer not to answer option to respect people's autonomy. It is a challenge to cross-culturally compare between different levels of education, mostly because of the diverse educational levels and degrees. Our target countries have different types of degrees. For example, the terms associate degree used in the States is not common in many countries such as Greece, Cyprus, Georgia, Chile, and Indonesia. In addition, different countries have different educational stages. For example, the term basic education in Chile consists of 8 grades and encompasses both the United States, the US stages of the elementary and junior high school. Furthermore, you cannot conduct meaningful cross-cultural research without considering the context and other situational factors in each country. For example, after a small pilot study in Iran, one scale asking about how people perceive their culture, tight or loose, was considered too sensitive to be asked at the beginning of the survey, as it could predispose the participants in a negative way due to the current political developments in that country. Instead, the translator requested moving it at the end of the survey. In Ukraine, it was requested to ask about how the work of the respondents was affected by the war, while in all the other countries we solely asked about factors such as work disruptions due to the pandemic. Factors such as Wi-Fi accessibility and computer familiarity were also a challenge that came up during this year's project. Future studies will need to provide evidence about how these factors may interfere with the scale psychometric properties, and probably perform pilot studies before the sample is collected to make sure that the scales work well in the target population. In addition, the wording of items is a major challenge during the translation process. Subtle changes such as using synonyms to adjust to the context of the country can enhance comprehension, but more substantial changes such as removing items or significantly altering the structure of an already validated questionnaire need justification. And researchers should be prepared to provide psychometric evidence, for example, by using SAM or confirmatory factor analysis. This year's project organization was more meaningful to be stated as my place of work in Polish, as it will be incomprehensible to Pole working outside corporate environments. In addition, in the Serbian context, the translators suggested adjusting the entry question, do you have a full-time job? To do you work full-time, as many people in Serbia and Montenegro may have a full-time job, not be officially employed. In addition, the translators in Georgia suggested replacing the term mandatory quarantine with self-isolation, as mandatory quarantine due to COVID-19 is no longer implemented in that country. Researchers seem to underestimate the threat posed to the validity of the scale by changes in the response items, and the anchors are often not even included in the forward-backward translation process. However, as we notice, the way participants perceive the response scale, As we notice, the way participants perceive the response scale may be influenced by cultural factors and familiarity with completing surveys. For example, some scales have been created to start from 5, strongly agree, to 1, strongly disagree, while other scales use the reverse order. These constant alterations in the order of the response items was confusing for some participants in the Serbian sample. To ensure consistency with all the other countries, the PIs, the principal investigators, did not change the response items order just for Serbia, as this was considered a very intrusive change. But it is an aspect of research going forward and future studies to take the order of the response items into consideration as well. In addition, in Spanish, the words very false and false in the rating scales had the exact same meaning. All the translators agreed that the response scale should only anchor the endpoints and middle point to avoid confusing participants. Although this change was considered minor, the more a scale is altered, the greater the need to provide justification for the change. Researchers will need to ensure that the change will not cause difficulties in the comparability with all the other countries, and in case of intrusive changes, they will need to demonstrate psychometrically that the factorial structure, for example, of the scale is the same in every nation. Finally, we understand that creating a quadric survey in English is tricky, but creating one in other languages may pose additional challenges. The principal investigators found it particularly difficult for languages that read from right to left. One useful tool is to change the base language in the Qualtrics survey builder, if you use Qualtrics, of course, to align with the language of interest. To do this, go to the survey builder in Qualtrics, select translations, and then change the base language to the one you prefer. Today, we provided a brief introduction to Psi Chi's NICrowd Global Research Project, as well as discussed the translation processes we use and highlighted the changes we faced with this year's project. Thank you very much.
Thank you very
and
much.
What questions? And what questions do you have?
As a reminder, you can type your question into the Q&A box located on the right-hand side of your screen, and we will accept any questions you have regarding this topic, and then we can also move to our formal Q&A with all four speakers.
This is an interesting question. Okay.
Yeah. So let me start, and then you pick up, Antonios. These are definitely real research, and it is a way to provide research opportunity. The question here is, are these studies more of an educational exercise or a research process, or both? It can be both. For example, a professor teaching a research methods course or psychology course or course related to the topic of the study in the given year might decide to have the class participate in collecting research and becoming contributors as a class. Even if it is being conducted for the sake of an educational exercise, the ability to combine the data collection from across various smaller groups, like just a research methods class in one university, allows for a much larger N, and for the research methods then to be applied to a much larger group of subjects. The research is something that is available to contributors as far as later publications, but it's the original principal investigators who are the primary authors on the first publication. And after that, other people who participated in data collection can choose how much they wish to participate in writing, review, analyzing, and to affect where they appear in the long list of co-authors. Antonios?
Well, I would say that the NICrowd project was one of the greatest things happened to me during my undergraduate years at the University of Nicosia, Cyprus. Well, I was very fortunate to be a contributor to two NICrowd projects and collect data from Greece and Cyprus. Also, I was introduced into the procedure of forward-backward translation. I worked with one of my professors both in Greece and Cyprus to translate and adapt the questionnaires in Mary's project into Greek, and also learn more and also be involved in the preliminary analysis of one of our recent publications assessing grief in a cross-cultural sample, and learn more about statistics, how to perform different types of statistical tests. So it was a very, very helpful experience for me as an undergraduate student. And I know that many students also are also get research experience beyond their classical coursework. So many students are introduced to themes like statistics, like forward-backward translation. We know that these procedures are not perfect so far, but we try our best to improve them as much as possible. And even students choose to do their thesis via the Nice Crowd project. So it is a great, great educational opportunity for many of us.
Thank you. Antonia, so I'll read Kurt's question that do you believe, based on your experience with translating and working with the groups of translators, that diversity, equity, and inclusion initiatives might eventually lead to languages dropping genders of nouns and pronouns?
Oh, that's a very, this is a difficult topic. I mean, when you translate a scale into different languages, you have to take into consideration the language itself. So as we discussed, the languages differ in the extent to which they use nouns and pronouns in daily speaking, and using more inclusive terms, and even designing more inclusive terms, for example, to include non-binary identities, will require a huge effort from inside the country itself for these terms to be widely accepted. So I can see that initiatives may help to design new terms or make some terms in some languages more widely accepted, but they will require a lot of effort, at least in my opinion, in several countries. For example, in Greek, we do not have, as I told you, a specific pronoun, a specific term for non-binary identity, and there is no an acceptable term in psychological research so far to make our questionnaires more inclusive, but it is totally something to discuss with Greek and Cypriot psychologists and with the general public as well. But it requires to take into consideration cultural differences and how ready is a culture to include these terms as well.
And to complicate the matter, some languages also have masculine, feminine, and neutral pronouns and nouns as well. So I think it's going to vary quite a bit over time and over cultures, regardless of what DEI initiatives are accepted in the countries. I think we are switching to an opportunity for people to ask questions of any of us. So I'll get the ball rolling and ask a question of Kurt and Tony. If you could improve on what Psi Chi and Antonios have been working on with the Nice Crowd projects, do you have words of advice to improve the way that we've been going about adapting and translating measures?
That will be very helpful. Thank you, Martha, for asking this question.
I'll jump in first. I'm not sure we've reached that point. And this is, Tony talked about qualitative and quantitative and made that distinction. There are parts of our fields, all of our fields, that we'd like to believe are science, but there's still a lot of art there. And I'm not sure that we have one definitive approach that works best yet. I have some concerns about forward and backward translation. I like the simultaneous translation quite a bit, but that doesn't work if you've already got a pre-existing measure. And I think the key is to get enough people involved that you've got the languages covered and the cultures covered, and people understand the construct and how it might manifest itself in different languages and cultures. So I recommend more than one person, I guess, being involved. But that's not how lots of translations have been done or adaptations have been done in the past. But I think it's if you get multiple people, then you get some questioning of, oh my goodness, what about governments in Egypt? Why, why, what government would ask these questions or something like that? And or you get to someone, since Antonios is from Cyprus, perhaps there are some differences between Cypriot Greek and Greek Greek. I don't know if that's true or not, but he might pick up on that if they're translating something for Cyprus that others would not be able to pick up on. And so I think it's really important that you have multiple perspectives there to try to address both culture and language.
I think we are at least doing that, but it makes me nervous sometimes, the examples of how easy it is to make a mistake. But Tony, do you have other advice? I think you're still muted.
I'm sorry. Thank you for alerting me to that. For comments. Number one, having been involved with the Weschler scales for quite some time, they've never done simultaneous translations. And the ones from other countries are also disconnected and not integrated. So we end up having a little bit of this and a little bit of that, which is basically a big old mess. Now, the MMPI 3, which I was involved in, did a simultaneous study of both the English and the Spanish version. That was unusual. Now, having said that, since I led the Spanish portions, it took a lot of money, a lot of time, and many, many different teams. You know, Pearson really put a lot of effort and cash to support that activity. It's the only one of its kind that I've really seen. Ourselves, we've been working on a free, cloud-based, multilingual, multicultural neuropsychological evaluation battery that would be free. However, it's taken us €500,000 to develop. Uh, that was 5 years ago. 5 more years are working at all kinds of challenges with the iPads, and just a tremendous amount of struggle. Okay, so it's just insanely hard, insanely hard. The system and the technology is not geared for that. Now, can you imagine that a new project for NICE might be something like that?
Not if it costs
Let me also say, we've made real steps. I mentioned that one of my doctoral students studied the EWA that was developed for Puerto Rico. Well, what they actually did, as you may know, on the WACE, it's typical that you start with the vocabulary test. They simply translated each of the words that were on the WACE into Spanish and then had that as the vocabulary test. Well, in English, they were ordered in terms of difficulty. That level of difficulty was absolutely zero. The correlation was zero with the order after they were translated into Spanish. So it made no sense at all. And I think that now that was a test that was probably done in the early to mid 70s. And I think we've made a lot of progress, but we have more to go.
And I think part
We have
of
some
the
questions in
difficulty, Right. And before we go to that next question, is just I know Tony mentioned qualitative research, and the part of the point of our project is making it available to students and making it easy to conduct anywhere in the globe, and being very open to people at any university participating. So why don't I read for all of you the question we have before us, one of them. As a consumer of healthcare and rehabilitation research, I've noticed an increase in the number of published studies being done in countries with different cultural milieus from the United States where I work. I often wonder if the findings from these studies, for example, done in China or India, are applicable within the US. For example, neuropsychological intervention research. What do you think about how consumers of research done outside of the US should consider these cultural and linguistic factors, when interpreting the findings from these studies?
Do they expect us to answer such a complicated and really deep question? That's a tough one. That's a tough one.
But that's a very
Martha, you
good
want to take a crack?
question.
Yeah, well, you want to take a crack, Martha? And by the way, we only have
all I
10
would say,
minutes, so maybe a short answer. Go ahead.
all I would say is that it's important to consider the possible cultural influence using the results from another culture within your own culture, um, or as a consumer of research. Um, I think it's more of a problem for consumers of research to know about the results of studies conducted outside of their own country. And that's something that I think if we could do more of that, so that we could know who the uh, well-known researchers in various countries are, uh, across countries, that would be helpful and make that kind of consumer issue easier to address.
Although I'd like to
Today,
make
it
Next
was part of
one,
the.
I'd make
Go
one
ahead.
quick point, which is years ago I was at a conference in Hong Kong, and one of the leaders of APA was there, and I'll leave his or her name out. And after we attended a few sessions, the person sidled over to me and said, you know, we need to get more Americans going to international conferences because they don't realize how good the work being done around the world is. And I think we shouldn't confuse cultural differences with the quality of work, because there are really talented psychologists all around the world right now.
In the Global Alliance presentation earlier this morning, one of our foreign colleagues was saying, how do you expect us to publish in your journals when you're asking us to pay $2,000 for publication fees and our salaries are basically $100 a month? You know, really? It's a huge problem. The question is a tough one and one we need to address. We're running short on time. Maybe we can tackle the other question that we have on here.
Is there a working group for developing standards for adaptation, moving beyond guidelines? That may be for you, Kurt, as you mentioned some of the guidelines.
Well, this gets into a tricky situation. ITC is an international group. It sticks to guidelines, and it's trying to help people. But you know, APA, AERA, and NCME have standards, but theoretically, standards, using the word, they're really guidelines, because a standard is supposed to have enforcement. By the term standards, are supposed to be enforcement mechanisms. So in other words, if you don't do something that would be in the test standards, you could be sued or something, and so, or lose your license or whatnot. And the standards do not, they deliberately have chosen not to go that way. But the problem they have is that the document is known as the standard, so you change the name to guidelines and no one would know what it is. So you know, it's like lots of things. Once the name is out, you don't want to change it. So
along those lines, let me be clear that I was part of the standards back in 2014. It was actually a 5-year process, and you will get sued, and you will lose your license, and you'll have ethical complaints, and that is the standard that you'll be compared to. Now you can debate it, and that's certainly possible. But if you do, or if you're going to be challenged for an audit by insurance company, by a licensing board, or some legal other standards like criminality, that is the standard you will be compared to. But here's an idea. Why don't we, as 3 of us, for example, or 4 of us, send a note to APA and say, when you revise the new standards, please include a section on adaptation. We have to be careful that we don't end up modifying constructs and tests, and we continue to be true to making sure that psychological science and practice is universally appropriate and useful.
And would you say too
there
that
has
some
been
of the problems
discussion
with
of the ISO, the International Standards Organizations, doing an international test standards, and APA has tried to fight that actually.
Disappointing.
and so maybe along the lines of what I was saying is, and Antonios mentioned that the education is very different. What's that? Not just how many people go, but in some countries they don't have an associate degree, or in some countries you can become a psychologist with a 4-year degree. So creating standards that apply in every country become even more complicated because the educational systems differ and the licensing requirements differ so much.
But I find it fascinating, Martha and others, that to be a professor of psychology in many of these countries, like for example Spain, you have to have a PhD. But to practice psychology, you have to have five-year degree. Why is it that we even have a discrepancy among ourselves, between ourselves in terms of the issues of what is a practicing psychologist terminal degree and what a professional psychology at the university? It should be the same. Whatever it is, we should not make practicing psychologists less trained or educated than anywhere else. It's a tough road to head.
Mhm.
Well, can I ask a question of our student? Okay, all of us on this conversation except you are very old human beings. So there is our future is our future is very limited. You, on the other hand, are bright and young. You think we have a future to have one psychologist, especially when it comes to testing? Oh my goodness! I asked
Can
him a
you
hard
repeat the
question, and
question,
his
please?
internet.
Because
Yes.
I
no,
think his
If
internet
I
you
think
are,
problem.
the microphone didn't. Yeah,
is there a
could you
future?
please repeat it?
Is there a future? Is there a future for one psychological vision and where tests can be universally applicable? What do you think?
Oh, that's a hard question, and I would say that no. I mean, you mentioned intelligence in your presentation. Let's think of intelligence. What is intelligence? There is no definition actually that is cross-culturally appropriate. A person in Miami may be considered intelligent if they remember the streets and where to go, what street to follow to go home. But a person in I don't know, a person in Africa may not consider it the same way. For them, intelligence may be that they are good hunters, or that they are good group leaders, for example, in their village. So what we will need to think the construct we measure first, and see if the construct is different in every country, in every culture, basically. And if we need to make a single test for every culture, do we actually measure the same contrast? Do we actually measure intelligence? Can we measure intelligence via paperwork, for example, when going to Africa and visiting people from a tribe there? The same way we measure intelligence in the United States. So I think that in my opinion, as a graduate student, we will need to devise different ways of testing rather than be based on a single test, right? To assess different constructs and different ways. We will need to devise different ways of testing people, ways that make sense. For example, I remember one study made in Australia with a tribe there, and they actually tried to measure what in Western world defined as intelligence with rocks and with objects, basically, and not paperwork. And they gave it to people there, and the people actually managed to see special relationships better by combining rocks rather than special relationships in a tailored test, in neuropsychological testing, for example, or other tests we use. I hope that this question is adequate. This response is adequate.
Thank you very much.
Thank you. I want to thank Dr. Puente, Dr. Geisinger, and future Dr. Cagialas for participating today. And I hope that our listeners have found this session useful. Thank you.
Thank you all so much. We certainly appreciate your expertise and the audience for being with us today. At this time, we want to thank everyone, and on behalf of the APA, we would like to thank our presenters for today's presentation. And thank you all for tuning into today's program. Remember, to receive continuing education credit, please complete the evaluation. You will receive your documentation of CE credits soon after. This concludes today's presentation. We thank you so very much and have a great day.